I was like, all right, great. So it's September 18th, 2024. Everybody, thank you. We are here for a regional meeting to continue some work around the topic of homelessness and the goal of getting some collaboration and really today doing a couple things about hearing back from the work that everybody's involved in. So the agenda's up there on the screen, and we'll try and follow really carefully on our time. But I do want to do introductions really quick before we get going. So I'm going to start. I'm like, who doesn't have food in their mouth? We'll start on this side here in the room, and then we'll go online to folks online.
Hi, everybody. My name is Jen Savage. I'm the trustee for the.
Thank you. Barbara Hamilton, council member in Louisville.
Lauren Folkerts, council member in Boulder. Lee Rogan, mayor of Alliance.
Thanks for joining us.
Susie Longfellow, city council, Longmont.
Right.
Katie Grove, Director of Division of Homeless Systems and Coordinated Response.
Janet Peterson, Boulder County Administrator.
MJ Adams, Affordable Housing Manager for the town of Erie.
Thank you.
Christiane Pacheco, Human Services Director, Longmont.
Humberto Mendoza, Human Services Program Manager, City of Loachamin.
Susanna Lopez Baker, Boulder County Housing Department Director.
Thank you. Thanks everyone for being here. It looks like we've got Katrina Sama, Mayor Billy's online, and Councilmember Sampson. So if you want to do quick introductions in that order, that'd be amazing.
I think you said me first, Katrina Harms, Peak to Peak Housing and Human Services Alliance, and I'm here supporting Mayor Billy.
Thank you.
Thank you, Sama Fox, Interim City Manager for Louisville.
Thanks for joining.
Nicole Sampson, City of Lafayette City Council.
Thank you for joining. We had the mayor on there for a second.
Yeah, it looked like he popped out.
Oh,
There he is.
do you want to do a quick intro, Mayor?
Oh yeah, Mayor Billy Gibbon, Ned.
Thanks for joining us. All right. Amazing. And my name is Marta Loachamin. I'm one of the county commissioners representing Boulder County. Thank you for joining us here at the courthouse and appreciate everybody, all your work. Let's go through really quick just as far as what we're going to do this first part, and we're going to we're going to try and really give enough time for this discussion and dialogue and questions from everybody. There was some homework assignments and in regards to just prepping, going to your councils, to your boards, et cetera, to find out where are people in regards to an opportunity to update folks who may not have been part of the initial summit, and then also to just let your folks know what you're working on this particular committee, because I know everybody's involved in a whole lot of work. But we have some questions just to find out, are we all in alignment? Are we all in agreement about the all-in-one plan? So we're going to go through that and give folks an opportunity to share. And then we've got an activity just talking about really the why of what we're working on and what we're doing. And so for folks online, Heidi's going to help us do a breakout room so that you all can do that activity together. And then we had asked last meeting for staff to have an opportunity to share what do they, from their roles, what do they not want us to do? And we asked, like we said, we are willing to listen as electeds and really follow your expertise. And so they have put some presentation together, and I know we're all appreciative of that. And then we do need to have a conversation about the next meeting. And so my hope is kind of from where we come, that'll give us the guidance of what we think we're going to be doing and focusing in October. So staff can help us with any particular homework assignments or just additional pieces that we need to work on in the interim. Is there anything that is missing from here that people thought we were going to be discussing or that want to add to the agenda? Great. Thank you. So let's go into this first piece of, if you remember the last meeting, what we were really working on was going through all of the feedback from the initial summit and looking at a high level of here's the items that had been most discussed, most agreed on, and we decided to really look at these first two pieces of the agreements that, one, as elected officials, could we work on advocacy for funding? That was the first piece. And then the second one was what we had, and there was some great discussion around, we don't want to leave out this other piece of creation of affordable housing. And so those were the two that we were really working. So the first question, and I just want to give an opportunity for a quick introduction. You just finished introduction, so it's perfect timing. Don't be at all.
I'm Megan Newton. I work for the City of Boulder in Housing and Human Services as the policy advisor on homelessness.
Thanks for joining us, and there is food, and you're welcome to be here and join us. So that's the first question. Does your team, does your board, does your council, is everybody in agreement with these priorities? So I want to give folks an opportunity to share. And I see a hand up. Councilmember Sampson.
Yes, thank you. So I wanted to say, number two, we really support. But number one, I think needs to be edited because ultimately, couple things that we know. First of all, the ongoing federal level funding isn't necessarily going away. And my understanding is this bullet point came from the concern of federal funding going away. So the ongoing funding, the home funds, the community development block grant funds, the emergency shelter grant funds, the loans that HUD gives out, the HUD 202 loans for special populations, those aren't necessarily going away where like the ARPA funds are going away. The problem that I actually see in a lot of these federal funding is, and we learned a lot through the ARPA funds, is many of them are limited on what you can use the funding for. And so I'm thinking rather than advocating for funding, advocating for some great successes we learned with using ARPA funds as to apply those. So great example of this would be we learned a lot with the emergency rental assistance program that a lot of organizations were being funded with CDBG, the Community Development Block Grant Program, for only 1 to 3 months. We knew that it takes at least 6 months in many cases for people to continue on and do that. Another one, land banking. You're not able to do land banking with a lot of the federal funds. So I'm wondering if we could adjust this slightly, that the advocacy is to allow us to use that ongoing funding for the things that we've really had successes in as a result of the last couple of years.
Thank you. I just have a curiosity as I'm taking notes as a suggestion, and I want to make sure I'm capturing this right. To allow us to use funding for housing funding, current federal funding, or to allow us to use new funding?
No, the ongoing funding that hasn't been going away, a lot of the funding that has been there since 1968, 1970s, they've been there for a while. So I'm suggesting that the restrictions on the use of funds needs to open up. That's what we need to advocate for. We need to advocate for that and more vouchers.
So to consider advocacy to eliminate restrictions on current funding sources around housing. Okay.
Yes.
Thank you. Who else has some thoughts in regards to the agreements?
Yeah. So there's a lot of interest in making sure that this includes advocating for supportive services and PHS funding, as well as inpatient treatment for mental health, substance use disorders. A lot of that stemming from the really low number of beds that we have for those services in our state as a whole.
So funding for supportive services, dosage funding, mental health, and funding for
Well,
beds.
yeah, specifically the inpatient treatment for mental health and substance abuse. I mean, also generally mental health.
Other input that folks give. Yeah.
So our board was generally, it's, where it aligns as a bit of an outlier in that we are so difficult to reach with public transportation and we don't have services in town. You know, Leaf serves people who live within the greater Lyons area. And so we look at it a little bit differently. And while, yes, we are absolutely in support of these, also we look at how can we prevent homelessness from happening in the first place. And so I think about folks who need rental assistance or need assistance to make a home habitable. And that kind of funding.
So yes, supporting of these, and
And,
what
yeah.
about ERAP and or habitability funding?
Yeah, I mean, I guess I'm not sure what that's called, what the term for that is, you know, but I think you know what I mean. Yeah,
I made up a term.
I like it. It's a new kind of funding.
Staff is gonna tell me in a minute what I missed, and I appreciate that.
So with our council individuals that I've had a chance to chat with or hear back from, I think there was some concern around, you know, what does that advocacy for local, state, federal funding look like? And is that going to give us the most bang for our buck as far as chasing grants as opposed to actually creating with what we have already? I think, so I'm trying to synthesize what different perspectives were coming in. And I think, you know, just, do we have the capacity to have staff, you know, work on writing these grants and applying for funding? I really like what Nicole had mentioned, and that kind of changes. I think more council members will be on board if we start looking at advocating for how we can use those dollars. So I think about the Zinnia project that we have that has that will have wraparound services. It would be nice to be able to, rather than have to depend so heavily on nonprofits to make this happen, but actually have the state and federal funding to support these efforts. And making sure we have the right kind of support. So I think, you know, there are beds out there, but there aren't people to provide the types of services needed. So, you know, in experiences that I've seen and that we've had in our own family, is we might have somebody who could treat one aspect, maybe the drug addiction aspect, but can't, you know, the disability. Or you have therapists and professionals who could work with the disability part, but they don't have experience with addiction. So finding the right kind of people and what kind of supports can the state and federal government provide that ensure that we have the right kinds of supportive services. So that's, and you know, because homelessness, there's various reasons why someone ends up unhoused, and getting to those root problems, those root causes, I think would be, you know, something advantageous for us if we could get funding that supports the specific needs of individuals. So
Yeah, so,
but, and I think, you know, for the support and creation of affordable housing to address unhoused, we have individuals who said, council members who thought, you know, to include permanent as well as transitional housing as well.
so what I heard was a question around staff capacity that I'm sure everybody has that question. And it's good to share what you're hearing from your team.
Yeah.
Advocating about the use of funding, that's kind of
Yeah.
second to what. Seth said. And then, and for the right kind of supportive services.
Yes, yes.
Including PSH and transition housing.
Are we considering both of those or just the first one?
Both of them,
Okay,
yeah, you can add more, is that true?
maybe, yeah.
Yeah, of course.
Okay, well, on the first one, that kind of brought up something else that with my memory on, which was also around kind of the structure, like, is that a county, I mean, we already do state and not so much federal, but we do a lot of state advocacy on our own behalf. And so how is what this is different from what we already do? Is the county providing structure that really helps us do it better. And then I got some people on my council are really strongly about the supportive services piece. So one of the pieces of feedback I got several times is sort of like, but this second one is really important and should really be 2 items. And the supportive services piece could be a whole world unto itself. And just the desire to see, again, PSH mentioned specifically, and then also making sure that includes services for people with disabilities and kind of just the whole range of services.
That's a good question about how would advocacy be different than what is already done. Desire for supportive services. I'm hearing wraparound services, but that might not be what you're trying to say when you say a whole,
I mean, I
the
think
whole gamut of services.
wraparound services, but also I think in the trying to prevent homelessness space, there's also, we do have a lot of gaps in terms of access to mental and behavioral health that do play a role in trying to prevent homelessness as well. And so it's just the availability of affordable options for that, along with the services that are actually tied to housing.
So something along homelessness service prevention. And I'm trying to see if there's alignment somewhere. That's what I'm looking for. That's why I'm taking notes to try and help us. Because I am a visual person, so that's helpful to me. Go ahead.
I think what everybody's trying to get to is a multidisciplinary approach to addressing homelessness. So that would be, substance abuse paired with a behavioral health specialist that has a licensed professional counselor and maybe even an occupational therapist or those kinds of things.
Is that one?
Yeah. I think that, some of the comments I was hearing from my council also come out of concerns that we've heard around budget cuts at the shelter and things like that, and wanting to make sure that this larger web of services stays intact and is funded at an adequate level.
Yeah. And I'm happy to be the person that delivers the same startling message that is actually not new news. The funding sources, both federal and state, are gonna change the way that all of us can respond. Unfortunately, we are in the midst of, like everybody, and there was some other meetings earlier this morning. But the reality is the grant funding and those sources are not the same that they have been in the past. So that's just the state that we're in, this place that we're in, and we're gonna all continue to do. To me, this is a great reason, an additional reason of why we're regionally, like what can we agree? And I will just say, well, I wish we had the multi-million amount of money that this would take to do that. And so for me, and we had this conversation at MAC, was like, we don't have endless resources. We do have a regional capacity and we serve thousands of residents. So what could this group agree with in there? And it makes me feel a little bit like there's almost some definitions that maybe this group wants to focus on, like spending some time about what does that mean? And can we agree on it? Because it might be too broad. We might want to define it. And I don't think we can agree to work on 4 or 5 things to be really effective. Typically, like if we could choose one thing to focus on or 2 things to focus on, maybe 3. But if everybody in here feels like, no, I can absolutely commit to focus on 5 major pieces that we believe is going to be impactful right now, I'm ready to listen. So I want to hear from you all about listening to the conversation from everybody together. Because I also heard the capacity question, which I think is a real reason. It's not just the money capacity. Again, thinking about us as elected officials.
You share how some of the conversations went in Louisville.
Thanks.
Yeah, of course. In the past month, I've connected with my fellow council members. I also took time to meet with our police chief, our director of library services, and our parks and open space director to get some feet on the street perspective from our staff regarding what specifically is our experience in Louisville and how does it fit into this regional approach. As far as the first bullet point goes, without getting into the details of the specifics of the words and such, just broadly speaking, there's general consensus among those I spoke to regarding being on board with advocating for funding. We as a municipality simply don't have the funds to stand up these services and support them on our own. So, and we recognize that it's our responsibility to contribute to the solution. So we are on board with continuing the conversation about how do we secure funding, OPM, right, other people's money, to try to bolster and really strengthen the existing services we have in our county. As far as bullet point number 2 goes, again, there was general consensus among those whom I talked to about the brick and mortar and also the services. The services, I feel, in my conversations were probably floating up a little more with our experience simply because we don't necessarily have it's how do I put this? It's a complex challenge, right? And what we're seeing in our community with some of the staff members I've talked to are some individuals who tend to come for a little bit, then they disappear for 3 to 6 months, then they come back in our community, and that leads us to believe that maybe the services part, we can help support them with that. I want to bring to the table a question that Chief and I talked about, and I'm wondering if this is a participant that's missing from this room, and it's EBSD. So in chatting with Chief, he and I were talking about the school resource officers, and when that program sunsetted, his department lost visibility into the families in our community that are impacted by homelessness. I understand BBSD has resources and such that support those individuals, but this came up in our conversation talking about hidden homelessness. I explored that in addition to visibility of the people I talked to. So I just wanted to bring that into this room, the BBSD part, and if we think they would be an important member to converse with as we explore this further.
Thanks for that. That sounds like general support, at least conceptually what's up here. And maybe adding.
I would just add St. Green Valley School District as well.
Yeah.
Very much more.
Yeah.
Just, I mean, do we want to talk about that? Now, or do we want to add that on to some more?
They're engaged in community homeless work groups.
Yeah.
Good to know.
And are there for electeds in the room, if you're not familiar with the work that's being done, like, would it be helpful to this group to either ask folks to, if they would want to join us for October and November meeting, or if they want to come present, like, would that be helpful for folks?
It would be helpful for me.
Thanks.
Do you mean, sorry?
Yes.
Yes.
Wait, do you mean about like the programs, like the information that we found about understanding all of everything available? Is that what you mean? Like, do our electeds in our community see more information? I didn't understand what you were asking if we needed, expanding on all that is available. Like beyond what came in the email, like the information that they provided in the email was good for me. And we didn't have any, everybody was super supportive and Superior because we have limited staff, limited space. So for us, a regional approach is preferred. I think that's a win for us. And the expectation that funding down the road would be a part that would be contributed from us is also for the okay with everybody. So mine aren't really looking for a lot more information, which besides of that. But for me, taking back to them is really just clarifying how many. I mean, we have like 36% of our population makes under 50K, and it's crazy expensive to live there. So I don't think the housing security, I don't think there's a problem. And I think that's the role for me is communicating that we actually do need these services. We want to keep people in homes, and with the funding changing, potentially the idea that homelessness isn't a Superior problem is maybe not the way it will stay, right?
And, in response to that, that idea of hidden homelessness. So the thing, in working with our homeless liaison, Luis Chavez, we learned so many, and I'm a teacher at Indian Peaks Elementary, so we are a Title I school, bilingual school. I mean, we've had students that we didn't even realize were living out of their car. They're, considered unhoused. They're sleeping on the couch at a relative's apartment. So I think, being able to pull back and understand what the numbers are, that people who say, oh, well, there's no problem because you're not seeing somebody pushing a cart in the street, that there are several unhoused, we just don't see them in our day-to-day because what the individual situation might be like. So I think, having the data and the numbers, that would also be very beneficial as we look to advocate especially at the state and federal level. This is something that is needed. And, and if we're able to come up with a secure plan of how we want these funds to be used, what types of supportive housing we're looking to build. I'm really excited that we have the Zinnia project through Longline Housing Authority, because as that, I think it's next month, they're starting to fill out we're getting tenants in for these spaces. So, we'll have a work that we can see, oh, this is successful. This is why we need state and federal funding to be able to support these kinds of housing for individuals to get them on the trajectory of self-sustainability. So I think, having those numbers does help us.
Yeah, I would say that mirrored a lot of the comments that I got to my council around interest in, we have Dr. Cobb just did a housing needs assessment, but can we have like a homelessness needs assessment? We're looking at not only what the current need is, but what the projected need might be, as well as can.
Yeah.
Projecting is always hard, but
Yeah.
I guess, and like what kind of service.
Did all of you do the housing? Like, did all?
We did.
So it wasn't, I wasn't sure, because I know that you could opt into it if you wanted to, and if it's a requirement. That's just the reason why I have the data, is because we just did ours. That's- But that's a helpful starting point. I think for the conversation in our community, it was just this. You don't see this if you're housing secure, that this is happening.
Yeah.
I have a question. So this meeting structure has been largely about individual homelessness, and this conversation we're having now is family homelessness. So the question that Rebecca and I are wondering, do we want to bring family homelessness into that space? Because it's a different set of, that's why you haven't heard a lot about it, is it's a different approach here in Boulder County, and coordinated entry is very different. And you can talk about that.
So, yes, thank you. And I apologize, I didn't.
No, it's okay.
I was looking around earlier and then I got comfortable. For me, there's two items that for like, could be posted or it could be right now, and either one is totally fine. We have about 5 minutes just allotted for this part of the discussion, but I also think it's a rich conversation. For me, there's still an outstanding question about how would hearing from BBSC or St. Vrain Valley School District help us as electeds in this conversation have a better understanding of what those numbers are and what homelessness. That to me is also the question of, do we define actually both of those questions or both of those agreements to more specificity? Because otherwise, so that's a question. And if we did that, do we do that now or do we plan to do that October, November? Go ahead.
Just, if we do go down this path, I do want to warn everyone, McKinney-Vento has a very, very different definition of homelessness than HUD. And it gets very complicated very quickly.
Is it possible to hear what we shouldn't do before we decide?
Very good. I was waiting for somebody to say that.
That's what we should do.
Yes.
I'm okay waiting to see,
Yeah.
to loosely develop this work. It sounds like all of our boards are generally supportive of what we're doing here with the possibility of tweaking stuff. So I'm fine with like paring it down later or defining it better later.
Thank you. Okay, so no, that's perfect. So online, I want to make sure there was anybody else that wanted to talk about their conversations about agreements. May, are you in a place to be able to share? We can't hear you if you are trying to speak. Oh, yes. Okay, if you want to jump in at some point, just raise your hand or just come off mute and I'll try and pay attention.
Sorry, folks. I'm cooking dinner and my wife has somewhere to go and my kids are fighting and just a bad moment. So I'll participate later, hopefully.
Okay, yeah, just let us know. And we can take care of your kiddos.
Katrina, frankly, may have more to offer than me, and but I'm happy to join in at just this moment. It was not a good one, so sorry.
No problem, no problem. Katrina, do you want to share any input?
Sure, I've been loosely following and was Mayor Billy and I met earlier today. I feel like the need for services is what we're looking for up here, and everything that I've been hearing from everybody talking, I can't hear all of it, but it's going in the direction that I think the mayor and I had talked about. So you're all good.
Okay, thank you. And I apologize. That's a good reminder for us to speak up a little bit more in this room. So thank you. And I heard maybe a focus on those 2 points, maybe a focus more towards part 2 of number 2.
Yeah.
Is how I'm now describing it in my notes here.
Right.
Okay,
Agreed.
that's great. Thank you. So we've got a couple items potentially on the post-its for later. Thank you. So thank you. Hold on to all of those thoughts. They're not gonna go away. We've set up to talk about the why next. Does that still feel like the right order? Okay, perfect. All right, so we're gonna do an activity here.
How many people know who this guy is? Yeah, all right. So, so as a forewarning, this is the shortest clip that I could find of the infamous TED Talk. So he speaks really fast. I think they recorded it and then put it on like 2 times fast. So I just want to forewarn everyone. So.
Probably the world's simplest idea. I call it the golden circle. This little idea explains why some organizations and some leaders are able to inspire where others aren't. Every single person, every single organization on the planet knows what they do 100%. Some know how they do it, but very, very few people or organizations know why they do what they do. By why, I mean, what's your purpose? What's your cause? What's your belief? And why should anyone care? The inspired leaders and the inspired organizations all think, act, and communicate from the inside out. Let me give you an example. If Apple were like everyone else, a marketing message from them might sound like this. We make great computers. They're beautifully designed, simple to use, and user-friendly. Want to buy one? Meh. That's how most marketing is done. That's how most sales is done. We say what we do. We say how we're different or how we better, and we expect some sort of behavior, a purchase, a vote, something like that. Here's how Apple actually communicates. Everything we do, we believe in challenging the status quo. We believe in thinking differently. The way we challenge the status quo is by making our products beautifully designed, simple to use, and user-friendly. Want to buy one? People don't buy what you do, people buy why you do it. The goal is not to do business with everybody who needs what you have. The goal is to do business with people who believe what you believe. Again, the goal is not just to sell people who need what you have, the goal is to sell to people who believe what you believe. If you hire people just because they can do a job, they'll work for your money. But if you hire people who believe what you believe, they work for you with blood and sweat and tears. Something called the law of diffusion of innovation. The first 2.5% of our population are our innovators. The next 13.5% of our population are our early adopters. The next 34% are your early majority, your late majority, and your laggards. But if you want mass market success or mass market acceptance of an idea, you cannot have it until you achieve this tipping point between 15 and 18% market penetration. So it's this here, this little gap that you have to close. Because you see, the early majority will not try something until someone else has tried it first. And these guys, the innovators and the early adopters, they're more comfortable making those intuitive decisions that are driven by what they believe about the world and not just what product is available. These are the people who stood online for 6 hours to buy an iPhone when they first came out. Leaders hold a position of power or authority, but those who lead inspire us. And it's those who start with why that have the ability to inspire those around them or find others who inspire them. Thank you very much.
Thank you. You're welcome. Sometimes it's a good reminder. I'm happy to share that video if you want to watch it again. So I think Councilmember, you made a good point. Why? How do you tell the rest of your community that our housing stable, that this is important? And so Commissioner Loachamin and I thought it would be really good to explore our own whys and our collective whys. And so we're gonna do a fun activity called the 9 Whys. And Mayor Billy and Councilmember Sampson, we're gonna have you guys break out into a separate room to do the same activity so that you guys don't feel left out. So we brought some awesome sticky notes and some pens. And what we're gonna do is spend some time writing your own why.
Is there tissue?
I mean,
I feel like.
do we have tissue?
Oh, I love that you guys have a tissue.
We have napkins, does that count? And then we're gonna pair up with someone you don't know well, which I get a feeling a lot of folks don't really know each other well in this room. And we have the whole floor. So if you feel compelled to not be in this room, please go in the hall. There's lots of chairs out there. And you're gonna pair up with someone and you're gonna interview them for 5 minutes, which is that lovely skill called active listening. And you're gonna ask them to share their whys in response to why do you, as a leader, volunteer, because you guys are volunteers, to work on complex social issues like homelessness that have multiple systemic challenges. And then when you pair up, you're gonna ask, the interviewer is gonna ask that person that question. And you're gonna ask, why is that important to you? And then you're gonna keep asking why, and not in a condescending way. Like not your 5-year-old that's like, well, why can't I? Why? But in like a really genuinely interested, I'm curious way to really reach a fundamental purpose of why this work is important. And then you're gonna switch and do the same. And then we're gonna come back together and we're gonna share across the board and try to identify our collective. And I'm sorry, Councilmember, I did not bring tissues, but we can find a tissue box.
I probably won't cry. I was sort of kidding, but this is emotional stuff, you know, your whys.
Your whys are important, and they mean something, right? They are what drives you when you're exhausted and when you've worked a 15-hour day and still have the energy to respond to things. So it matters.
Does anybody have any questions about the process before we?
Everybody enjoyed, right?
Except for me, because I'm facilitating, sorry.
That's
Okay, and you're gonna scream out like 1 minute left.
Yep, I'll be the timekeeper.
And I'm gonna pause the recording for this, so we.
Yeah.
Thank you, and I was gonna ask maybe we mute the room so that
Yes.
they can concentrate as well. Okay. Anybody online have questions before we send you out to your room? Okay.
So I'm gonna jump into the meeting so that I can do the break.
And I just want to check